In the past few decades, we've seen Sarawak progress from a quaint, quiet little place to what it is today. Technology, medical facilities, the attraction of talent, young and old. But along with that, we also now face what could be seen as first world challenges. Today, let's talk about things that we keep in the dark. Things that most of us are afraid of. The M word, mental health. But hang on, why am I even whispering? There's no shame in talking about mental health. It's 2023. Sarawak should seriously talk about mental health.
Filled with illness and disease, Arif is on a quest for informed health, presenting My Health, My Choice. One host, 27 experts. All about health issues in Sarawak.
How am I supposed to know all this?
How dare you say like that to an older lady?
You simok lah. You okay? Hey. Lomba bis. Take a look at these photos. Can you guess who has a mental health disorder? Could it be this guy who is pulling his hair out of frustration? Or could it be this one who looks rather sad? Or maybe this guy who's flashing a wide smile? The thing is, it's impossible to tell. When it comes to struggling with mental health, we might be used to images like this. But you might look fine from the outside, but struggling from the inside. And that's okay, because you're not alone. We have mental wellness when we have good mental health. We might have heard mental health disorder is an urban problem. That is not true. In Sarawak, we can find people with afflicted mental health everywhere. Anybody can struggle with mental health. And anyone who struggles with mental health should know that you are not alone. Whatever you experience is not abnormal. In fact, it's a very human experience. Did you know 1 out of 4 Malaysians show depressive symptoms? In Kuching alone, about 26% of adolescents shows depressive symptoms, and the cases are higher in the B40 group. Anybody can struggle with mental health. But why can't we treat it with the normalcy it deserves?
To learn more about mental wellness, Arif meets Dr. Ravi, a psychiatrist at Hospital Miri, who is a mental health advocate.
Sarawakians and conversation about mental health. Your thoughts on it? Is it a taboo still, or are people more open to talk about it?
People are certainly more open, but taboo and stigma still exists within society. That's why people don't present early. People are still living with mental illness, and that's probably related to a lack of understanding of what stigma towards mental illness, wherein it is seen as a weakness, somewhat related to the lack of faith, and the whole part of being us and them. And there's a lot of intersectionalities towards it. People with mental illness also with other stigmatized identities. Good mental health isn't just the part where you don't have mental illness. You need optimal level of mental health in order to function in every aspect of your daily life. Let it be your work, your role as a person within your community, your family. I think we should start by listening without judgment,
By the way, we have a background music. Hope you don't mind, Dr. Ivy. Gives up the mood a bit. So when you mention listen first, right? Is it expected when we listen, we do not respond?
I think being present is the idea. It's not responding. Of course, you do need to respond. If you don't respond, I mean, if you're just being completely silent, not taking in what they say, that's not listening, that's hearing. So if you want to listen, you probably want to pay attention. We can't really understand what's going on in a person's mind. But what happens is when you listen, you seek to understand the situation. At least you can sense that distress or what's going on in that person's life. And that brings in and that can tap into your skills of empathizing and providing assistance for that person. You can always go back, you can always just take a step back and say that, oh, maybe I didn't do that so well. Is that better? And I learned that through years as a clinician that we really don't start out as the best. It's a work in progress. So it's okay. But let's not try to reinforce our own values and our own beliefs into someone else. I mean, that's a good start.
My health, my choice. Your health, your choice. My health, my choice. Your health, your choice. We all have bad days. Some days we just feel like the world is against you or you're feeling down. But when and how do we know that it's time for us to seek help from experts?
This is unfortunately often asked question and an unfortunately no direct answer question, because you have a huge spectrum of what distress is. Distress is very individual to each person. For someone, the same incident or same experience may look like the same experience, but that same experience can be experienced in so many different ways by different people. I guess it's when you realize that you can't handle it, when it starts to interfere with your day-to-day activities. You can't work, you can't function in your usual roles, you can't do the things that you are able to do. Your sleep is affected, your appetite is affected. These are signs where there's actually possibly a disorder. And a disorder is probably also has a time factor to it. There's always weeks of where problems actually sit in. And that's when if you're feeling low for most of the days, for more than 2 weeks, you could be depressed. Again, could be.
Could you also share with us about trying to understand what you're feeling or on the topic of mental health? Anything that we need to be aware of or something that we need to be mindful of?
I'm going to take an unpopular opinion here. Often people say don't become a Google Doc or a Google psychologist, but we are all guilty of that. We all do that because information is now very much available there. And fair enough, there are a lot of screeners online, very credible screeners. It's good, but take that information as a signal as opposed to a diagnosis. When you feel that you can't cope anymore and you feel like that, or you're having really abnormal experiences, very unusual experiences, that's also when you should actually seek help too.
Here we are going on our daily lives. We're busy with our work, we're busy with the things that we do apart from work. What could be done in terms of creating better habits for ourselves in terms of taking care of our mental health?
That comes into self-care, and the only way you can care for yourself is actually be aware of what's going on with yourself. A lot of people are not aware what's going on with their body and their minds as well. There are a lot of people that go around day to day not even knowing how they feel. Sometimes they don't even recognize their emotions. There are a good number of people who recognize but also push it aside as well because they got some more important thing to do. Self-care comes in various forms, looking after your basic needs like sleep, food, rest, working in decent hours. There's a reason why work hours are stipulated that way, so you have enough rest, and there's a reason why people have recreation and hobby and all of that. And it's also important that in that whole conversation of self-care, we don't accidentally get involved in ways that we try to care for ourselves, but in fact it brings a lot of harm to ourselves. Example is excessive use of illicit substances like drugs, excessive use of alcohol, self-harm for that matter.
How do we find that balance between caring about yourself and trying not to be so selfish, caring about others too?
I think as long as you look after yourself without taking away someone else's rights, I think that's okay. To be contextualized, I would not want people coming after daggers with me for that. So,
You'll be safe, Dr. Arif, hopefully.
Quite a bit of the problems that we face when people face very much of ill health on this part is wherein we don't really know what our own boundaries and our own spaces are. So we allow our boundaries to be extremely lax or enmeshed. And the thing is, it doesn't happen overnight. It takes years, So this is when things have happened from your childhood, going on to your adolescence and adulthood and all. And that's why you see people living in toxic systems wherein there's actually absolutely no boundaries, where there's too much expressed emotions, and the thing where there's no space.
Mental health in children is another mental wellness issue in Malaysia. According to our Ministry of Health, 1 in 20 Malaysian children aged 5 to 9 are estimated to have mental disorders, and this includes developmental disorders. At the same time, in 2019, our National Health Morbidity Survey, the NHMS, found that 1 in 8 adolescents aged 10 to 19 have mental disorders.
In the context of children, how vulnerable are children and teenagers towards mental health?
The short answer to this, if they are vulnerable or not, yes, they are. 1/3 of mental health problems start before the age of 14. The disorders themselves start at the age of 14. Why so? The developing brain is like a sponge. It can take in a lot of good things, but it's also very sensitive to adverse experiences. And then you put in that context, not just their brain, their biology itself is unique, and the brain is developing, and if something happens, it sort of halts the development along with the disease sitting in there. It's very different to be a child who is depressed compared to an adult who becomes depressed. So when somebody is in charge of their care, their well-being and their safety, when that safety net doesn't function so well, it's very hard for the child to get the help that the child needs or the young person needs. So there is where the vulnerability comes and the powerlessness comes. Mental well-being and health across all ages doesn't just depend on that person and that immediate person around the person. People live within communities and societies and countries, and those bigger powers are able to manage social determinants, safeguards and incentives to ensure and encourage people stay in school, people get opportunities, people who are maybe starting off with a lot of adversities are given that opportunity to catch up. Even access to clean water, electricity, good food can sometimes be that game changer, and that when that lift happens, you offset that adverse childhood experience. So so you got to really invest lah. It's not just investing in services, it's also investment in communities. A lot of the WHO mental health pyramid, the base is actually informal support, self-care, community care, and of course also there needs to be a lot of investment in primary care and then tertiary care.
For those who wants to seek help, where can they go and who they can talk to?
There are a lot of health clinics around you. There are any kind of helplines that fit your need. If you are in a suicidal crisis or experiencing very odd and abnormal experiences, these are like hearing voices no one can see, hallucinations and delusions. This is actually coming towards psychosis. These are considered emergencies, and you need not to wait for this. You can go to any emergency room where you can seek help within your own community, your own living spaces, your own family members, people you feel you trust. Within Sarawak itself, there are quite a number of mental health volunteers and NGOs that actually do counseling within the community, and they reach into spaces that are normally not penetrated in as well. So those people too. We only can get to that state of progress together, not in isolation.
When it comes to mental wellness, we all need a listening ear. We all need a shoulder to lean on. And with a sustainable support system, it can go a long way. I'm here at Di Hati Grief Center, the first of its kind in Malaysia. It's one of the non-profit, community-based facilities that is available here in Sarawak for anybody who wants to talk about grief. And how does grief related to mental health? We'll find out in a moment. We'll also learn how this space is a symbol of love, community, and solidarity.
Arif is with Hanani, a volunteer from Di Hati Center.
So Di Hati Center for Grief, Bereavement and Trauma is a community center which provides grief peer support for the public or anyone who's just mourning or grieving a loss. It was established last year. As you can see, it was named after Di, who was the late Diana Zuraimi. She was a very remarkable and outstanding person to all those who knew her and who always advocated on empowering the community especially women. So after she passed, it was a dark and difficult time for her family and friends. And they were looking for a grief center like this, but there was none in Malaysia. So ultimately, they decided to establish the grief center here in Kuching to honor and remember her memory, and also to help those who have lost their loved ones and suffer from grief and bereavement.
Could you share with us what is grief?
Grief is a natural reaction or an emotional response due to loss of a beloved person. Not only that, grief can also be due to loss of a pet, loss of a job, physical injury causing loss of limbs or any other parts of the body, and also anticipating loss due to terminal illness too.
How does grief and mental health, mental well-being correlates with each other?
Grief differs from one person to another. Everyone grieves differently, but usually most people would experience mixed emotions from sadness, anger, loneliness, and hopelessness. Different people experience different intensity of these emotions. If they are not allowed to grieve properly at the time when they should be grieving, it could escalate and take a toll on their mental health later on. Some concerning symptoms would be prolonged sadness, depression, unable to carry out simple activities, and becoming socially detached from family and friends.
What would you say to someone who wants to seek help, but they're a bit in doubt and they're not sure or not confident enough to seek help?
I would say to take their time until they are comfortable enough at their own pace to step out, talk to someone, a person they can rely on, someone they trust, and just talk to that person.
What would be a good sentence to show validation to someone who goes to you and tell them about their grief?
I'm sure you've been going through a difficult time. I can't imagine what you are going through right now. If you need someone to talk to or someone to just listen, I'm here for you. Most importantly, you should avoid talking about yourself. Listen to the other party, and it's not about you.
Right.
It's about them.
Creating that safe space and
Yes.
listening to the person is more important, and to avoid talking about yourself.
Yes, that's true.
Could you share with us what's the center all about?
The center is prioritizing more on mindfulness, empathy, inclusivity, so which are part of our core values as well for the center. This is why we wish to reiterate and emphasize that non-professionals like us, we provide, our service is free. We do not charge for any visitations. And also, we want to emphasize that we are not a mental health institution, nor are we a clinic, but we are a center run by the community for the community. We work side by side with professionals by carrying out what we call task shifting. It's a strategy by WHO. Task shifting is a delegation or redistribution of tasks from professionals to non-professionals, allowing the non-professionals to empower the community. We help to reduce their load, the less severe cases, so the professionals can focus their resources on the higher priority cases. When the clients come, we will screen them first, ask them a series of questions, and if they are already pre-diagnosed or are on medications, then we are not able to interfere with that. So they will have to carry on with their treatment or consultations with their relevant professionals. If they needed to be referred to the relevant professionals, we can do that. We can be the link between the clients and the professionals.
For the public out there, individuals who is going through grief or mental health, we're not alone.
Yes.
And this is something that we can definitely talk more in the future, normalize talking about mental well-being, normalize talking about grief, so that we can create a healthy society.
The presence of family, friends, and community provide a sense of belonging to those who are grieving and also to those who are struggling with mental health, and also for their caregivers. They might feel isolated, so knowing there is a community you can rely on and there are people who support you can make you feel safe and give you a meaning and purpose to life. People tend to avoid seeking help due to the fear of being labeled or judged if they see a psychiatrist or a counselor. which is why community empowerment plays the role to provide grief support in this sense, as peers can also be sufficient enough to help each other. Knowing the right things to say can go a long way to help one another.
Right. Hanani, from your point of view, what are some of habits or things that we could incorporate in our daily life so that we can go through grief, or if we want to be better in terms of our mental well-being?
Some would say depression is the worries of the past and anxiety is the worries of the future. So the most important thing, I think, in my opinion, is to be mindful and be present, to stay in the present. They could do activities like journaling, just writing down whatever they feel, their honest thoughts, their honest feelings. They can also talk to people, get involved in community activities, and if they don't want to do it, they can always do it individually at their own time and pace.
Thank you so much for that, Hanani. It's not the end of the world. Mm-hmm. There is help out there. There is ways and other alternative for us to seek help, and centers like this center exist so that the public can actually be more open, and we're not alone.
We are not alone.
My health, my choice. Your health, your choice. My health, my choice. Your health, your choice. People come in different shapes and sizes, and that goes for their mental well-being too. We've just touched on a small part of this deep, big topic today. Our hopes for you is to go out there and find out more for yourself.
Don't be afraid to try your nearest GP or public health clinic. Visit community mental health centers or CMHC. Make an appointment at a psychiatry clinic at a general hospital, or see a private counselor or clinical psychologist or psychiatrist. If you feel like talking to someone, try dialing Talian Heal at 15555. The Befrienders Sarawak at 082-242-800. The Befrienders Malaysia at 03-762-72929. And if you encounter crises or psychosis episodes at any time, go to your nearest emergency room. It's easy to be nice to ourselves when life is going good, but when times get tough, we shouldn't give up on ourselves. The process is different for everyone, but as long as we're willing to make one small step, we're already getting somewhere. Don't be afraid to face what's inside you, and don't be afraid to reach out. Remember, my health, my choice. Your health, your choice.